What happens during an MSLT and how do you prepare? Imagine waking up and feeling extremely sleepy during the day, even after a full night's sleep. You might wonder what causes that constant tiredness. One way doctors find out is through a test called the multiple sleep latency test. This test is part of a group of sleep studies used to diagnose sleep disorders like narcolepsy or idiopathic hypersomnia. While it isn't used directly to diagnose sleep apnea, it often follows an overnight sleep study, known as polysomnography, which can detect sleep apnea and other issues. During the test, you will have 4 or 5 scheduled nap opportunities spaced about 2 hours apart. Each nap lasts up to 20 minutes. When you lie down, the sleep technologist will attach sensors to your head, face, and chin. These sensors monitor brain waves, eye movements, muscle activity, and other signals to see when you fall asleep and if you reach REM sleep. The technologist watches you through a low-light camera from a nearby room. If you fall asleep, the sensors track how quickly that happens and whether you enter REM sleep, which is the stage associated with vivid dreams. If you do not fall asleep within 20 minutes, the trial ends and you move on to the next scheduled nap. Preparing for an MSLT involves some key steps. Usually, you will have an overnight sleep study the night before to make sure you had enough sleep and to rule out sleep apnea. It's important to avoid caffeine, alcohol, and certain medications that can interfere with sleepiness or alertness, as advised by your doctor. You should stick to your normal sleep schedule in the days leading up to the test, so your body is used to your usual routine. On the day of the test, arrive well-rested but ready to try napping. Follow any specific instructions your healthcare provider gives you, especially about medication adjustments. From a sleep apnea perspective, the MSLT is often performed after an overnight sleep study that confirms sleep apnea. It helps determine how sleepy you still feel during the day after treatment or diagnosis. It also helps identify if other sleep disorders might be contributing to your tiredness. This makes the MSLT a helpful part of the overall process to understand your sleep health. In summary, the MSLT measures how quickly and often you fall asleep during multiple daytime naps and whether you reach REM sleep. Preparation includes an overnight sleep study and following your doctor's instructions about sleep habits and medications. This test provides objective information about your daytime sleepiness, helping doctors decide on the best treatment for your sleep issues.